As women move into their 70s, their health priorities begin to shift. Many tests that were once useful in earlier years may no longer provide the same benefits. In fact, certain medical checkups may bring more risks than rewards at this stage of life. It is important to focus on well-being and comfort rather than undergoing unnecessary procedures that could create anxiety or even harm. One such example is the mammogram. After 70, the chances of aggressive breast cancer developing are lower, and many cancers grow so slowly that they do not threaten life expectancy. However, mammograms still expose women to radiation and often lead to false alarms. These false alarms can result in painful biopsies, unnecessary treatments, and emotional distress without truly improving quality of life. Another checkup that may not be necessary after this age is the Pap smear. If a woman has had a history of normal results for many years, continuing this test does not add meaningful protection. At this stage, the cervix naturally changes with age, and repeated testing can create confusion or lead to procedures that bring no real benefit. Avoiding unnecessary Pap tests allows women to focus on more relevant aspects of health. Colonoscopies are also a concern for older women. While they are important earlier in life, after 70 the risks often outweigh the benefits. Colon cancer usually develops slowly, and the procedure itself carries risks such as bleeding, infection, or even bowel injury. Recovery can also be harder with age. For many women, the chances of harm from the procedure are greater than the chances of it saving their lives. Bone density tests are another area where caution is needed. While it is true that bones naturally thin with age, repeating these scans every year may not be helpful. Too much testing can lead doctors to prescribe powerful medications that have serious side effects. In many cases, longer intervals between bone density tests are safer and still provide enough information to guide healthy choices around diet, exercise, and bone care. Heart stress tests can also be problematic if there are no clear symptoms of heart disease. Many older women are sent for treadmill or imaging stress tests even without chest pain or related concerns. These tests can sometimes lead to invasive procedures that carry significant risks. Without symptoms, the likelihood of real benefit is small, and avoiding unnecessary testing can prevent further complications. Overall, the goal after 70 should be to focus on balance and quality of life. Not every screening adds more years, and many simply add stress, worry, or side effects. Testing can lead to false positives, unnecessary medications, and procedures that reduce well-being instead of protecting it. Choosing carefully, with the guidance of trusted healthcare professionals, allows older women to avoid harmful checkups and concentrate on what truly matters: living with comfort, peace of mind, and a focus on health that supports the years ahead. After the age of 70, many women continue to go through medical checkups simply because they have become a routine part of life. One such test is the Pap smear, which is commonly used to detect cervical cancer or precancerous changes. While this test is very important in earlier years, its value decreases once a woman has entered her 70s, especially if she has a long history of normal results. At this stage, the potential harms of repeated testing can outweigh the benefits. The cervix naturally undergoes changes with age, and these changes can sometimes be misinterpreted by laboratory tests. A Pap smear taken from an older woman may come back with unclear or abnormal results even when there is no real disease present. This can cause unnecessary stress and anxiety, leading women to worry about problems that may not exist at all. False positives from Pap smears often result in further procedures such as repeat tests, biopsies, or minor surgeries. For a woman over 70, these procedures are not only uncomfortable but may also increase the risk of complications. In some cases, women are treated for conditions that would never have caused any real harm, exposing them to side effects or recovery challenges that affect their quality of life. Another factor to consider is how slowly cervical cancer tends to develop. For women who have had decades of clear Pap smear results, the likelihood of a new, fast-growing cancer after 70 is very low. This means that continuing the test may not actually extend life expectancy or improve health outcomes. Instead, it can burden women with unnecessary interventions. Healthcare guidelines in many places already suggest stopping Pap smears after 70 if a woman has a consistent history of normal tests. This recommendation is based on research that shows little to no benefit in continuing beyond that point. By avoiding unnecessary testing, older women can save themselves from needless worry and focus more on maintaining overall wellness. It is also important to remember that the body changes with age, and healing becomes slower. If a biopsy or procedure is performed due to a pap smear result, recovery may take longer and may bring more discomfort compared to younger years. This highlights why prevention should not mean over-testing but rather making thoughtful choices about what truly supports health. In the end, deciding to stop pap smears after 70 is not about ignoring health, but about recognizing what is truly beneficial. Women who have taken care of themselves and kept up with their screenings throughout life can feel confident in stepping away from this test when the time comes. The focus should shift to other aspects of healthy aging, such as maintaining strength, balance, nutrition, and emotional well-being, which matter far more than repeating a test that no longer serves a real purpose. For many women, colonoscopies have long been recommended as a reliable way to detect colon cancer early. This screening test can be helpful at younger ages when the benefits of catching potential problems outweigh the risks. However, once a woman reaches 70, the balance begins to change. The body does not respond to procedures in the same way as it did decades earlier, and the potential harms of undergoing a colonoscopy can become greater than the potential benefits. One important factor to understand is how slowly colon cancer usually develops. In most cases, it can take 10 to 15 years for polyps in the colon to turn into cancer. By the time a woman reaches her 70s, especially if she has had normal screenings in the past, the chance of discovering a fast-growing cancer is low. This means that continuing colonoscopies may not add much protection, particularly if her overall health or life expectancy makes the likelihood of progression less concerning. The colonoscopy procedure itself is not without risks. It requires bowel preparation, which can be physically demanding and dehydrating for older women. During the procedure, complications such as bleeding, perforation of the bowel, or infection are possible. While these complications are rare in younger people, they are more common and more serious in women over 70 because the body heals more slowly and is more vulnerable to injury. Another issue is the use of sedation or anesthesia during the procedure. Many older women have additional health concerns such as high blood pressure, heart conditions, or diabetes. These conditions can make sedation riskier, sometimes leading to heart or breathing complications. What might be a routine procedure for a 50-year-old can become a far more dangerous undertaking for someone in her 70s. Even when the colonoscopy is completed safely, it can lead to findings that may not require treatment but still trigger further interventions. Small, harmless growths or slow-moving polyps might be removed, exposing women to unnecessary bleeding or discomfort. In some cases, follow-up procedures are suggested that may create more harm than good, especially when the condition would not have impacted the woman's life expectancy. Guidelines in many medical organizations now suggest stopping routine colonoscopies after a certain age, often around 70 or 75, especially if a woman has been consistently clear in earlier tests. These guidelines reflect research showing that the benefit of continued screening is very limited compared to the risks involved. Instead of focusing on invasive procedures, women can turn their attention to more practical ways of supporting digestive health through diet, hydration, and physical activity. The decision to stop colonoscopies after 70 is about more than medical numbers. It is about quality of life. Avoiding the physical strain, the emotional stress, and the potential dangers of the test allows women to spend more time enjoying their lives with comfort and peace of mind. Health at this stage should mean balance, thoughtful choices, and a focus on overall well-being rather than procedures that may cause more harm than help. Bone density testing is often recommended for women as they get older, since the risk of osteoporosis and fractures increases with age. These tests measure the strength of the bones and are usually done every few years to monitor changes. While they can be useful, repeating them too frequently after the age of 70 may not bring much benefit. Instead, they can lead to unnecessary treatments or cause women to worry about results that may not be very meaningful for their overall health. One of the issues with bone density tests is that bones naturally thin as part of the aging process. This does not always mean that a woman is at serious risk for fractures or that she needs heavy medications. When testing is done too often, small natural changes may appear alarming, even though they are expected with age. This can result in doctors recommending treatments that might not be necessary or helpful. The medications commonly prescribed for osteoporosis, such as bisphosphonates, can carry significant side effects. These may include digestive problems, jaw pain, or even rare fractures in other parts of the body. For a woman over 70, taking these medications without a strong medical reason may cause more harm than good. Avoiding frequent bone density scans helps reduce the chance of being placed on treatments that are not truly needed. Another consideration is that bone density does not always tell the full story of bone health. Factors such as balance, muscle strength, and nutrition play a large role in preventing falls and fractures. A woman may have a slightly lower bone density, but remain strong and active, which lowers her real risk of injury. By focusing too much on test results, the bigger picture of health and lifestyle may be overlooked. The stress of repeated testing should also be taken into account. Many older women feel anxious while waiting for results, worrying about whether their bones are weakening too quickly. This emotional strain can take a toll on well-being, especially when the test results do not change the treatment plan in a meaningful way. Reducing unnecessary testing allows women to focus on positive habits that actually support their bones, like staying active and eating well. Medical guidelines generally suggest that bone density tests should be done at longer intervals, such as every 5 to 10 years, depending on a woman's health history and risk factors. After 70, repeating the test every year is usually unnecessary. Longer breaks between tests provide enough information to make safe choices while avoiding unnecessary medications or stress. Ultimately, bone health after 70 should be supported by practical lifestyle habits rather than constant testing. Weight-bearing exercise, calcium and vitamin D intake, fall prevention strategies, and overall strength maintenance are far more valuable than repeating bone scans too often. By limiting these tests to when they are truly needed, women can avoid harm, reduce anxiety, and focus on living well with confidence in their natural aging process. Heart stress tests are often used to check how well the heart functions under pressure, usually by exercising on a treadmill or through imaging techniques with medication. These tests are helpful for people who show signs of heart disease, such as chest pain or shortness of breath. However, once a woman reaches her 70s, especially if she does not have symptoms, stress tests may do more harm than good. Many older women are still referred for them as part of routine checkups, even when there is no real need. One of the main problems with unnecessary stress tests is that they can give misleading results. Older women may not be able to perform well on the treadmill due to normal age, related changes in stamina, or joint health. This can make the test appear abnormal even when the heart is healthy. Such results often lead to additional tests or procedures that may not actually be needed, exposing women to risks without real benefits. If a stress test suggests a problem, the next step is often an invasive procedure like an angiogram. While these tests provide more detail about the heart, they come with risks of bleeding, infection, or even complications from the dye used in imaging. For a woman in her 70s, the risks of these procedures can be significant, especially if she does not have symptoms of heart disease to begin with. Another important factor to consider is that unnecessary heart procedures do not always improve quality of life or extend lifespan in older adults. In many cases, lifestyle adjustments and basic preventive care provide better outcomes than going through risky interventions. By avoiding unnecessary stress tests, women can reduce their chances of being pulled into a chain of treatments that may not actually help them live longer or feel better. The emotional side effects should also be recognized. Receiving an abnormal test result, even if it is false, can create fear and anxiety about heart health. This worry can affect daily life, cause sleep problems, and make women feel fragile when they may in fact be healthy. Avoiding unnecessary stress tests can prevent this cycle of needless worry and help maintain peace of mind. Guidelines from many health experts suggest that stress tests should be reserved for people with actual symptoms or strong risk factors. After 70, routine screening with stress tests is not recommended unless there are clear warning signs. This approach helps focus medical attention where it is most useful while protecting older women from unnecessary risks. Ultimately, heart health at this stage of life should be supported through practical measures like healthy eating, staying active, managing blood pressure, and reducing stress. These habits do more to protect the heart than an unnecessary test ever could. By avoiding stress tests without symptoms, Women over 70 can safeguard themselves from harm and concentrate on living with confidence, comfort, and true well-being. Emotional stress from repeated tests is a serious concern that often does not get enough attention. As women age, the focus of healthcare should shift toward comfort, balance, and quality of life. However, when medical checkups are repeated unnecessarily, they can bring more anxiety than reassurance. Waiting for test results, worrying about what they might show, and fearing potential follow-up procedures can weigh heavily on the mind, especially for women over 70 who may already be dealing with other health challenges. False positives are one of the most common triggers of stress. A test may show something unusual even when nothing is truly wrong, leading to repeated scans, biopsies, or other procedures. While the body may be able to heal from these interventions, the mind is often left unsettled. Living with the fear that something might be wrong, even temporarily, can reduce peace of mind and lower overall happiness. The stress caused by constant medical testing can also affect the body directly. Anxiety raises blood pressure, disturbs sleep, and may even weaken the immune system over time. For older women, these effects can make existing conditions worse or create new problems. Instead of promoting health, unnecessary testing may actually harm it by fueling ongoing worry and tension. Another important factor is how emotional stress can reduce confidence in one's own body. Women who are tested repeatedly may begin to feel fragile or overly dependent on medical procedures, even when they are relatively healthy. This loss of trust in one's natural strength can affect independence and make aging feel more burdensome than it needs to be. The impact of stress also extends into daily life. Women may spend weeks feeling anxious while waiting for results, avoiding social activities, or feeling distracted from enjoying time with family. This kind of ongoing tension can diminish the joy and fulfillment that are especially important in the later years of life. Avoiding unnecessary checkups helps protect emotional well-being and allows women to focus on the parts of life that bring comfort and happiness. It is also worth noting that emotional stress does not only affect the individual, but can spread to loved ones. Family members may share the same worries, becoming anxious about possible health issues and feeling drained by repeated trips to clinics or hospitals. By reducing unnecessary tests, the emotional burden on both the woman and her family can be eased, allowing more time to be spent together positively. In the end, health should mean more than just chasing after test results. Protecting emotional peace is just as important as protecting physical well-being. For women over 70, avoiding the cycle of repeated, unnecessary testing can provide freedom from constant worry. This creates space for a healthier balance, one that values calm, confidence, and the enjoyment of life as much as medical care itself. Many health conditions that appear in later life tend to progress at a very slow pace, often much slower than people expect. After the age of 70, the body changes in ways that make some illnesses less likely to develop quickly enough to cause serious problems. This is one of the main reasons why certain medical tests and screenings lose their value with age. Detecting something that is unlikely to progress into a harmful stage can lead to unnecessary treatment that creates more stress and risk than the condition itself ever would. One clear example is the way some cancers develop in older adults. Many of these cancers grow so slowly that they never become life-threatening during a person's remaining years. Detecting them through routine screenings might seem useful, but in reality, it often results in additional tests, biopsies, or treatments that are difficult for the body to handle at an advanced age. Instead of improving health, these interventions may reduce comfort and quality of life. The same is true for certain heart conditions that are mild and stable. A test might show a small irregularity that appears concerning on paper, but does not actually cause symptoms or require intervention. Acting on these findings can place older women through unnecessary procedures, each carrying risks such as complications from anesthesia or slow recovery times. In many cases, the heart condition would never have developed into a serious threat. Bone health provides another example. Bones naturally thin with age, but this process is usually gradual. Detecting small changes through frequent bone density tests may lead to strong medications that have unpleasant side effects, even though the risk of a dangerous fracture might not be very high. In this situation, the slow progression of bone loss means that lifestyle choices such as exercise, diet, and fall prevention are often safer and more effective than constant testing. Emotional well Being also suffers when slowly progressing conditions are treated as urgent problems. Receiving a diagnosis, even of something that is unlikely to cause harm, can lead to stress, worry, and a feeling of fragility. Older women may spend more time fearing what might happen rather than enjoying the life they have. By recognizing the slow nature of many conditions, it becomes easier to avoid this unnecessary anxiety. Doctors increasingly recommend focusing on symptoms rather than on test results alone for people in their 70s and beyond. If a condition is not causing discomfort, pain, or functional problems, it may not require aggressive investigation or treatment. This shift in approach helps preserve both physical health and emotional balance, allowing women to prioritize comfort, independence, and meaningful activities. In the end, understanding that many conditions progress very slowly helps guide better decisions about healthcare after 70. It encourages a thoughtful balance between prevention and over-treatment. Instead of chasing every possible abnormality, women can focus on maintaining strength, energy, and peace of mind, knowing that not every medical finding demands action. This approach protects both health and happiness, making the later years more fulfilling. Unnecessary medications can create more harm than good, especially for women over 70. At this stage of life, the body becomes more sensitive to the effects of drugs. Kidneys and liver, which process medications, often work less efficiently, meaning even normal doses can stay in the body longer and have stronger effects. This makes older women more vulnerable to side effects, interactions, and complications that younger people may handle more easily. One common problem is being prescribed medication for conditions that may not actually require treatment. For example, a test may show a mild change in bone density or a minor irregularity in the heart, leading to a prescription even though the condition might never cause symptoms. In these cases, the woman ends up taking drugs daily, exposing her to risks without any real benefit to her health. Polypharmacy, or taking multiple medications at once, becomes more common with age. Many women are already prescribed medicines for blood pressure, diabetes, or other chronic conditions. Adding unnecessary medications on top of these increases the chances of dangerous drug interactions. Some drugs may cancel each other out, while others can combine to create harmful side effects such as dizziness, confusion, or excessive bleeding. Side effects are not just uncomfortable. They can be life-threatening. Certain medications for bone health may cause digestive problems, while others prescribed for heart irregularities may lead to weakness or fainting. For older women, even something like dizziness from a drug can result in a serious fall, leading to fractures or loss of independence. What seems like a small side effect can quickly become a major health issue. Another overlooked problem is the psychological burden of being over-medicated. Taking too many pills every day can make women feel dependent on prescriptions rather than confident in their own health. It can also be overwhelming to manage complicated schedules, which sometimes leads to mistakes in dosage. This stress reduces quality of life and creates a feeling of fragility, even when the woman may otherwise be relatively healthy. Doctors are beginning to recognize that prescribing fewer medications is often safer for older adults. Instead of treating every minor test result with a pill, the focus is shifting toward lifestyle adjustments like healthy eating, gentle exercise, and stress management. These approaches support overall health without exposing women to the dangers of unnecessary drugs. They also encourage women to remain active participants in their own care rather than relying heavily on prescriptions. In the end, avoiding unnecessary medications after 70 is about protecting both the body and the mind. By limiting prescriptions to what is truly essential, women can reduce their risk of side effects, simplify their daily routines, and feel more in control of their health. This balanced approach allows them to live with greater independence and comfort, focusing on well-being rather than constant concern over pills and their consequences. The stress, procedures, and treatments that follow an early diagnosis may create more discomfort than the condition itself ever would. Shifting the focus to comfort means recognizing that health is not just about adding years to life, but about improving the quality of those years. Many tests and treatments can be exhausting, painful, or anxiety-inducing, and they may not extend life in a significant way. Instead, prioritizing comfort ensures that older women can spend more of their time living well, free from unnecessary medical burdens that do not truly improve their day-to-day existence. Balance is another key element. Healthcare at this age should not be about doing everything possible, but about doing what is truly necessary and beneficial. Striking a balance means asking whether a test or treatment will actually improve life, or whether it might instead cause side effects, stress, or harm. By weighing these factors carefully, women can avoid being overtreated and instead focus on the aspects of care that genuinely matter. One example of this shift is choosing not to undergo a screening that could lead to invasive procedures without clear benefit. Early detection might reveal a condition that grows so slowly it would never cause problems in a woman's lifetime. In such cases, pursuing aggressive treatments may only bring discomfort and risk. By focusing instead on balance, the decision can lean toward peace of mind and daily well-being rather than endless interventions. This approach also respects the natural process of aging. Growing older is not an illness to be fought with constant tests but a stage of life that deserves dignity and care. Comfort-focused healthcare supports independence, calm, and stability. It allows women to spend time with family, pursue hobbies, and enjoy the activities that bring joy, rather than being tied to repeated visits, scans, and procedures that may not change outcomes. Emotional health benefits from this perspective as well. When the focus shifts away from early detection at all costs, women are less likely to live in fear of what might show up on the next test. Instead, they can focus on maintaining strength, staying active, and appreciating the life they have. This creates a more positive outlook, reducing anxiety and encouraging healthier habits that support both mind and body. Ultimately, the shift from early detection to comfort and balance is about redefining what health means after 70. It is no longer just about preventing every possible illness, but about choosing wisely to protect quality of life. By focusing on comfort, independence, and emotional well-being, women can enjoy a fuller, calmer, and healthier later life without the burden of unnecessary medical interventions. Personalized care becomes especially important after the age of 70 because every woman's health story is different. Some may be very active and healthy with few medical problems, while others may be managing several chronic conditions. Treating all women the same at this age by applying routine tests and screenings can create unnecessary risks for some and overlook the unique needs of others. A more thoughtful approach is to consider individual history, lifestyle, and personal goals when deciding what care is truly needed. Blanket testing often assumes that what is good for one person is good for everyone, but this is rarely the case. A woman who has had consistently normal screenings for decades may not need the same checkups as someone with a family history of certain diseases. Personalized care recognizes these differences and avoids wasting time, energy, and emotional strength on procedures that are unlikely to provide benefits. Another advantage of personalized care is that it puts the individual's quality of life at the center of decision-making. Some women may value avoiding hospital visits and stressful procedures, even if it means skipping a test that might detect something minor. Others may feel more comfortable continuing certain checkups for peace of mind. By tailoring care to each woman's preferences and priorities, the healthcare system supports dignity and independence rather than imposing a one-size-fits-all plan. Medical risks also vary greatly from person to person. A woman who has strong overall health may tolerate certain treatments better, while another with frailty or multiple conditions may face higher chances of complications. Personalized care ensures that these risks are carefully weighed, so that decisions are made not just based on age, but on the full picture of a woman's health. The emotional benefits of personalized care should not be overlooked. When women feel heard and understood by their doctors, they experience greater trust and less anxiety. Knowing that their care plan is based on their personal situation rather than a generic guideline brings reassurance. It also encourages them to take a more active role in their health, since they see that their choices and preferences matter. Personalized care also adapts over time. What is appropriate at 70 may change at 75 or 80, depending on how health and lifestyle evolve. Instead of following a rigid schedule of tests, doctors and patients can revisit decisions regularly, making adjustments that reflect current needs. This flexibility helps women avoid unnecessary procedures while still receiving care that keeps them safe and supported. In the end, personalized care ensures that women over 70 are treated as individuals, not statistics. It avoids the harm of blanket testing and creates a healthcare experience that is more respectful, balanced, and effective. By focusing on what truly fits each person's body, history, and goals, women can age with greater confidence, comfort, and peace of mind, knowing that their care is tailored to them.